That just seems wrong. In certain career paths where we have a desperate need for folks in these jobs, certified nursing assistants is probably the best example. Wages aren't great despite us needing those folks. And as we just reported today, somewhere between 3 and 13% of CNAs ever make it to full nurse status, despite those are supposed to be stackable pathways.
So, what we know from our work with the American Association of Colleges of Nursing is that healthcare employers are telling us that only 9% of nurses are practice ready when they get on the job, and 36% of nurses leave within the first year. And if I had to hypothesize why that might be, it's because our institutions, our colleges that are preparing nurses, are incentivized to do one thing: get those people to pass an NCLEX exam. That NCLEX exam does not emulate what it takes to be a nurse in the field and on the job. And shame on us for churning out nurses. Shame on us, though, for churning out graduates, taking their money and making it so they are not prepared to be successful and then want to get the heck out of there after a year of being on the job. And so when I think about these stackable pathways from certified nursing assistant, medical assistant, on paper, it's a great idea because we don't want to create pathways to poverty, right? And when we say there are stackable pathways, the reality is today there aren't. If you are a CNA and you spent 5 years being a CNA or a medical assistant, when you go to nursing school, you have to start over. And our most valuable commodity as human beings, regardless of where we are in our lives, is our time. And we don't have a way to actually acknowledge the skills and the abilities that a CNA or an MA has, ingest that from a systems perspective in higher ed, and actually say, hey, guess what? Anatomy and physiology, you got that one. Compassionate care and dispositions, I'm going to come watch you and I'm going to verify that skill. You're done with that one. Now let's work on the 70 other competencies that I need you to spend time getting so you can be a practice ready nurse on day one. And I do think that with making these credentials stackable, because it's not an either or proposition, it's like, take this little bite size, take that off ramp, go be a medical assistant, come back to us, but we're not going to make you start over. We're going to acknowledge the skills and competencies you have and build the system that way. So in Arkansas, we worked with the American Association of Colleges of Nursing to map what are the skills and competencies from CNA, MA, LVN to RN to BSN. We need granularity to be able to create seamless on and off ramps for people. If not, it's just lip service to a stackable pathway that still leads to poverty.